Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Webbe Nisbett, health educator at the Health Promotion Unit. The Zika virus is an epidemic in Central and South America and a health concern worldwide. As a result, I find it fitting for us to have a conversation about Zika virus, although we have no reported cases in the Federation of St. Kitts and Nevis. To go into detail about the Zika virus and its cause and effect, I have with me Dr. Nisbett, Medical Officer of Health in Nevis, as well as Mr. Anthony Webb, Port Health Officer. Good evening, Mr. Webb and Dr. Nisbett. Good evening.
Good evening to you.
Okay, Dr. Nisbett, what is Zika virus?
Well, Zika virus is a microorganism. It's a virus that is responsible for the Zika virus infection. This is not really a new virus. This virus was discovered some 69 years ago in 1947 in the Zika forest in Uganda. There were some researchers there that were doing research on yellow fever in rhesus monkeys, and they found this new virus. New, when I say new, it's quote unquote new. Most likely this virus was always present in monkeys, but it was discovered by these researchers in 1947 in Uganda in the Zika forest. And this is how it got its name, the Zika virus.
Okay.
In 1952, it was isolated from humans in Uganda and in Tanzania, and later in 1968, it was isolated from humans in Nigeria. Now, between 1968 and 1977, there were sporadic cases reported throughout Africa and Southeast Asia. But it is in 1977 that there was a small outbreak in Indonesia, and later in 2007 there was a small outbreak in Micronesia. But the large outbreaks came in 2013, and this was in French Polynesia, in the South Pacific. This lasted about 5 months. And then later on, we saw an outbreak in Brazil, and the first reported cases were in May of 2015. Since then, we have seen the spread of the Zika virus throughout Central America, throughout South America, and now we have had a reported 33 territories reporting local spread of the virus within their populations. Of these 33 territories, there are 16 within the Caribbean. And you probably would be interested in knowing the countries that are reporting local spread. When we say local spread, we mean it's not from somebody traveling out and coming back in with the virus. Okay. There's evidence that they spread from person to person throughout the territories.
Okay.
And these persons have no travel history. Okay? So the countries right now within the Caribbean region are Aruba, Bonaire, Curacao, Barbados, the U.S. Virgin Islands, Puerto Rico, Haiti, the Dominican Republic, Jamaica, Guadeloupe, Martinique, French Saint Martin, Dutch Saint Martin, Guyana, St. Vincent and the Grenadines, and Trinidad and Tobago. So you can see then that the virus is spreading.
Yes, it is.
And it's basically a matter of time, I think, before it arrives at our shores.
Right.
Because we have the conditions that are ripe for the spread of the virus. We have the vector that spreads the virus, which is the Aedes aegypti mosquito.
Okay.
And we have a population that is not immune to the virus. So we have susceptible persons. We have never seen the virus before, and therefore we don't have an immunity to the virus.
Okay, got you.
So because of that, we have conditions that are ripe for the spread of Zika within our population.
How is the Zika virus spread?
It's spread a couple of ways. The main way that it's spread is through the mosquito.
Okay.
The vector is the Aedes aegypti mosquito, and we have the Aedes aegypti mosquito here in Nevis. So if an infected person is bitten by an Aedes aegypti mosquito, and that mosquito then goes on to bite an uninfected person, then that virus spreads from the infected person to the uninfected person. Okay? Now, this Aedes aegypti mosquito, remember, is the same mosquito that spreads dengue, spreads chikungunya, spreads yellow fever. Okay? Now, another way that has been reported as a mode of transmission is sexual transmission. There are reports of about 14 suspected cases of sexual transmission. 2 have been confirmed. The male partners traveled to Central America. When they came back, they had symptoms of the Zika virus. They had unprotected sexual intercourse with their partners who did not travel.
Okay.
And when I say unprotected, I mean without a condom. And later, like a few days later, or at least a week later, these partners who had not traveled developed symptoms of the Zika virus and tested and were positive for Zika. So there's evidence that there's sexual transmission of the Zika virus. There's also mother-to-child transmission. There's strong evidence that there might be mother-to-child transmission. Okay? And that can happen during pregnancy, during delivery, but there's no evidence that it occurs during breastfeeding.
Okay.
And of course, there's always the potential for spread through blood transfusions.
Of course.
Okay? But the main mode of transmission and the mode that we are most concerned about would be through the mosquito. Okay?
And just to make it clear, so you can't get Zika virus by just standing next to somebody
You
who
cannot,
has it, right?
no. You cannot, it's not that kind of direct transmission.
Okay.
Okay? It's through the mosquito, and then there is mounting evidence that it might be sexually transmitted, and of course the mother-to-child transmission.
Okay. What are some of the signs and symptoms of Zika virus?
Okay, first I should say that it's not everybody who is bitten by the mosquito, it's not everybody who shows symptoms of the Zika virus. Okay? Only 1 in 4 persons will get symptoms if they're infected. 1 in 4 persons. So you could see then the majority of persons who are infected with Zika virus show no symptoms.
But they could still pass it on?
But they can still pass it on. Okay? So symptoms and signs are usually mild. They last for about several days to a week. And the symptoms are usually mild fever. So you just might have a little mild fever and you brush it off. Persons may get a rash. They may get joint pains. They may get red eyes or pink eyes. And some other symptoms are like muscle pain, headache, feeling weak and lethargic, pain behind the eyes, vomiting, abdominal pain, decreased appetite. But the main symptoms that concern persons would be the rash, the joint pains, the pink eyes, and the fever. But then it could be a combination of any of those symptoms that I described. So you see how similar the symptoms are to like dengue, chikungunya, and even sometimes the
The
flu.
right. That's what
So
I was
you might
thinking.
not know that it is Zika virus infection that you have. Or it be so mild that you don't seek medical care.
Right. What should one do if they start experiencing symptoms of the Zika virus?
Okay, person start experiencing symptoms of the Zika virus. I would advise that you visit your healthcare provider. It could be the health center, it could be your physician, and get some advice. Get treated, get some treatment. Right now, because we don't know if there is Zika virus here, we have no evidence that there is Zika virus here. We are very much interested in testing.
Okay.
Okay, so if persons have any of the symptoms that I described, pink eye, rash, a mild fever, joint pains, and remember it could be any combination, so you might not get a rash, right? You might have the fever and joint pains, okay, or the rash and joint pains or something like that. We ask you to visit your physician, tell them that you're having these symptoms, you're concerned it might be Zika, and the test would be offered. So we're interested right now in testing persons and confirming and finding out if Zika is here.
Okay.
Because it's in everybody's interest to know. Right? Now, there's no specific treatment. There's no vaccine for it. There's no specific treatment. So we treat the symptoms.
Okay.
So we treat the fever and the joint pains. And we ask persons to take only paracetamol or Panadols, Tylenol, or not things like Motrin, not Voltaren, not aspirin. The reason for this is because we're not too sure what it is that you have and if it's dengue or anything like that, or even Zika, because we're still learning so much about Zika. We don't want persons to bleed.
Okay.
And these can promote bleeding. Aspirin and the non-steroidal anti-inflammatories like Voltaren and Motrin, they can promote bleeding. So if you suspect that you have Zika, we ask you just to take paracetamol, or Panadols, or Tylenol for your pain and your fever, right? Get lots of rest, right? So lots of bed rest, drink lots of clear fluids, generous amounts of clear fluids, and you need also to protect others in your household or in your workplace if you go to work from getting the Zika.
Okay.
So it means then that you must wear repellent. You should wear long sleeved, light colored shirts and long pants. Okay. Sleep under a bed net. Even in the day, especially in the day actually. Sleep under a bed net. Okay? And ensure that your house is screened and so forth. So you need to protect persons from getting the Zika by protecting yourself from being bitten by the mosquito if you have symptoms of Zika. Of course, also, remember we said the chance of sexual transmission. So it means refrain from sexual intercourse, abstain, or use a condom.
Right.
All right?
If someone has the Zika virus, confirmed Zika virus, how long would they be sick for?
Usually they're sick for just about 2 days to 7 days.
Okay.
Yeah, just a few days.
Okay.
Within a week, they feel well.
Okay.
So the majority of persons don't have the symptoms longer than a week.
Okay. That's good. Zika virus is quickly becoming a worldwide epidemic. What about the virus is creating such an alert?
Yeah, because I just told you that it's a mild disease.
Yes.
So why the big alert, right?
Right.
So generally it's mild and persons recover in a week or less.
Yes.
But the concern is really the complications
Okay.
of the Zika virus infection. There's growing evidence that it may be causing microcephaly in newborns in the countries that have Zika virus outbreak.
Okay.
So places like Brazil have indicated that they have seen an increase in the number of babies born with small heads. Okay? And that's a little devastating in that the child may go on to have developmental delay, okay? Whether it's mentally, right, or physically. But I am saying there's a strong link, but we are not saying right now that it is because of Zika virus. But because you're seeing that increase, we're saying that there's a strong link to the Zika virus infection.
Okay.
So microcephaly is being, it's possible that it's due to the Zika virus infection. Also, we are seeing other neurological complications in newborns, malformations, there are miscarriages being reported, stillbirths being reported, and also affecting adults. There's the Guillain-Barré syndrome, a neurological syndrome that's affecting adults. So the adults get weakness of their limbs. They may go on to have paralysis, difficulty breathing, because the virus affects the body in a way. It causes the body to attack its own self. It's called an autoimmune disease.
Yes.
Okay, so the body attacks its nervous system and cause these effects. Most persons recover.
Okay.
They
Fully
recover fully
Okay.
from it. But these are things that they are seeing increasing in the areas that have Zika virus infection. So that is why, even though it's a mild disease, it's the complications that have us concerned. A very small number will get complications, but everybody matters,
That's true.
right?
That's
Everybody matters. So we have to be concerned about everybody.
With the microcephaly, so the mother it happens during pregnancy. Does she have to have the disease before, during? How does it work in terms of developing the disease
I think
or the virus?
I think that we're still
Okay.
investigating, but my guess would be shortly before or in the early stages. But then remember, a lot of research is being done, so we don't know exactly when in pregnancy that it's the highest chance of the baby developing microcephaly.
Okay. What are healthcare professionals advising childbearing age females as a result of the Zika virus?
Okay, so because of the effect that it may have on newborns, pregnant women and women of childbearing age must realize that they are at the same risk of getting bitten by a mosquito like anybody else in the population.
Right.
So we advise avoid exposure to mosquito bites. We give the same advice of wearing long-sleeved, light-colored clothing and long pants, sleep under a bed net, use repellents, and read the labels to ensure that this repellent is okay for you if you're pregnant. And of course, eliminate mosquitoes from your surroundings, whether it's around your workplace or at home.
Okay.
All right. Use condoms if you're gonna have sexual intercourse, because we're not sure if the male partner has Zika infection. Right.
True.
If you're planning pregnancy, before you plan your pregnancy, seek some advice from your healthcare provider. Is it a good time to get pregnant? What are your thoughts? You know. And if you're pregnant, attend your antenatal clinics, right? You'll be advised to get ultrasounds and so forth more frequently during your pregnancy, and try not to travel to a Zika infected area if you're pregnant or you're planning to become pregnant.
Right.
But we are not saying to persons, do not become pregnant, right? It's a person's right to become pregnant whenever they want to. So we are not saying at this time, do not get pregnant. We are saying take the necessary precautions if you're going to get pregnant or if you are pregnant.
So we've spoken a bit about the Zika virus itself with Dr. Nisbett. So now we're going to speak with Mr. Webbe about the mosquito itself. Mr. Webbe, what type of mosquito causes the Zika virus and how do we identify that mosquito?
The mosquito responsible for Zika virus is the mosquito known as the Aedes aegypti mosquitoes. Aedes aegypti mosquito.
Okay.
It is one of the 12 identify species of mosquitoes on the island of Nevis. It lives so close to us that it is regarded as being domesticated. It lives amongst us, very close. It's a black mosquito with white bands on its legs, its head, its thorax, its abdomen.
What time of day are the mosquitoes most active?
These mosquitoes are more active at dusk, late afternoon, and at dawn, early mornings. But they can also be moving around in the daytime.
Where do they usually hide in the daytime?
In the daytime, especially, they'd hang out amongst your clothing, in your clothes closets, outside in your basements, and outside of the house under plants with large leaves and stuff like that.
Okay. And how far can these mosquitoes travel? And what are some of the ways they can get from place to place?
Basically, the flight range is between 1 to 200 feet. So you find that we are presently in Craddock Road, and the mosquito that would bite someone in the Craddock Road area would not be the same mosquito that will bite someone in Jessup, for example, because that it is out of its flight range. But these mosquitoes are great travelers. They can travel from one place to the other in your cars, moving from one place to the other, and they can travel from country to country. Via aircrafts, ships, you name it.
Interesting. Okay, so let's talk about lowering their breeding areas and protecting ourselves from getting mosquito bites on our whole. What can be done in this regard?
One of the things that we find is that householders, for example, when they go to the supermarket to shop, on their shopping list is always a tin of insecticide, Bob, Shell Tox, Baygon, you name it. Their focus is getting rid of the mosquito, the adult mosquito, inside of the house. Inside of the house is being taken care of. But the point is, the mosquito is breeding in the immediate environs, outside the house, tins, bottles, tires, old stoves, old fridges, old washing machines that we have no further use for, but we are still holding on to. In your roof gutters, and people don't pay attention to that aspect. The bottom line is that we need to eliminate those breeding areas, those containers, the potential containers that can hold any water and breed mosquito. Getting rid of the mosquito before it reaches to the adult stage. That is what we need to do. In our homes, as I mentioned earlier, it is regarded as being domesticated. It breeds in our vases where we keep live flowers. It breeds in your dish rack, the tray that you use for draining your dishes. So we have to ensure that when all these areas are free of the water that is gonna enable these mosquitoes to hatch out.
Okay. How long after placing settled water do mosquitoes breed in the water?
I don't think that is issue, in the sense that a mosquito does not have to have water in a container to lay its eggs. The thing about the Aedes aegypti mosquito is that it can lay its eggs in a dry container, and 6-8 months later that container becomes filled with water and the eggs hatch out.
Wow. It's pretty resilient. Chemicals or substances can you use in the water to kill the wrigglers or?
What we usually advise is that persons who store water on the outside, they try to cover them to prevent the mosquito from getting inside of the container to lay its eggs. If is a container that you use for probably watering the flowers in your garden, for example, you can use a tablespoonful of kerosene oil, and make sure you get a stick or something and turn it up so that it spreads on the entire surface of the water for the mosquitoes, to prevent the mosquitoes, the wrigglers, for example, from gaining access to the surface to breathe. There's a larvicide that we use at the department known as A-bait, and that is thrown in the container, which takes care of the larva or pupal form of the mosquito.
And that is available to anybody who wants, or that's in use by the inspectors?
At the moment, it's for the use, by the department.
Okay. Okay, so Mr. Webb, would you say that mosquito breeding is an issue throughout the island?
Most definitely. Because as I mentioned earlier, householders are not doing what they're supposed to do. And that is getting rid of the potential breeding containers around us. We are still holding on to all these white goods, as I mentioned earlier, that can catch in water during rainfall and breed mosquitoes. We've had cases all around. You might have increased numbers in certain areas, Bath Village, for example, Craddock Road, Newcastle, and places in the Jindaland area. So I think the whole issue is for persons in the community to bond themselves together, get rid of all of these potential breeding containers from the community. I think that would help tremendously.
Okay. How exactly does a mosquito pass on a virus?
The thing is that only the female mosquito that bites, it has to get a blood meal before it can lay fertile eggs. The blood from a person is a source of protein for development of the eggs. So this female mosquito has to get a blood meal before it can lay fertile eggs. In terms of how the virus is transmitted from one person to the next, it has to be through the bite of a female mosquito. The mouth parts are built differently to those of the male. So the female has this pointed mouth part known as the proboscis, very pointed area there that pierces the skin of the person, and the development of the virus takes place in the gut, and the mosquito feeds somewhat like the fly. It brings up fluid from the stomach and places it under the skin to prevent the blood from clotting. So you find that a number of times when you do actually feel the itching on your skin is when the mosquito would have filled its belly already and left, and you're now feeling the reaction between what it would have brought up from its stomach and your skin itself. All right. In the transferring of the germ from the mosquito to the person, right? That person becomes infected, and then that germ develops in that person. And then another mosquito, another Aedes aegypti female mosquito, goes and sucks some blood from that other person and takes the germ from that person and passes on to another person in the feeding in feeding. All right.
Okay. If you're having mosquito issues, can you call in an inspector to evaluate your property?
Sure, you can. All complaints are treated as being true, and almost all complaints must be investigated. So if you have an issue where you're having mosquitoes, for example, buzzing around inside the house, and you're not certain as to where they're coming from, you can call in the inspector who has that knowledge of their breeding habits and stuff like that, and have the complaint investigated. You might not have mosquito breeding on your property per se, but you could have breeding probably on your neighbor's property. So once the complaint is investigated, we then have some knowledge as to what was creating the problem and address it.
Okay. And what is the department doing to help in controlling the mosquito issue on the island?
The department has a number of vector control officers who visit premises on a daily basis to check for mosquito breeding. And once found, this mosquito nuisance must be abated before they leave such premises. One of the challenges being, though, that sometimes you do not find householders at home. The number of persons work,
Right.
and therefore the vector control officer cannot gain access to the premises because the gates might be locked, or there might be dogs on the premises. So you find that is creating a little problem. Probably one might have to think in terms of devising a different strategy in terms of how do you get into those premises when the householders are at home.
Okay. And the last question I'm going to ask, I'm just going to throw a question there. So, as far as you know, are mosquitoes the only vector that carries the Zika virus?
Based on my knowledge, the Aedes aegypti mosquito is the only vector that carries the virus.
Okay. Wrapping up, I'm gonna ask each of you to give a few words, a few last words on Zika virus. It could be the Aedes aegypti, Mosquito. Anything you want to say? Closing remarks, Dr. Nisbett.
Like I said earlier, we have the Aedes aegypti mosquito. We have a population that has not been exposed, and therefore we expect that the Zika virus infection will spread, right? So persons should try to break that transmission cycle by doing the things that they ought to do, which means eliminating mosquito breeding in their homes, around their homes, in the communities in which they live and they work. Avoid exposure to mosquito bites. Right? Wear long-sleeved, cover themselves appropriately so that they don't get bitten. Use repellent and use bed nets at night and in the day, especially, as you know, Mr. Webb said, it's usually dusk and dawn. So whenever you're going to sleep, take down that bed net, sleep under that bed net, whether it's day or night. And screen your homes. So this is how we will break the transmission. If you do not get exposed to the virus, it means then that you can break the transmission cycle.
That's true. Mr. Webb?
Okay, as was mentioned earlier, we should focus on source reduction. That is getting rid of the breeding sites, the potential breeding containers that can hold in water and breed the mosquito. You find that too many times our focus is on inside the house when the mosquito is already out. What we're saying, we want to break that cycle. Getting rid of the mosquito. If there is no mosquito, then there'll be no laying of eggs. All right? If there are no potential breeding containers with water, for example, there'll be no laying of eggs. If there is no laying of eggs, there'll be no hatching into regulars or a larval form and pupal form. There'll be no adult mosquito. Persons in the household need to look at the different areas in and around your home that have containers that can hold in water and breed mosquitoes. Check your gutters on the rooftop periodically. In your homes where you keep live flowers, you want to change the water at least 2 to 3 times per week. And you must also remember to wash the roots off, because a lot of times if there are regulars in there, they will sort of cling to the roots. So you find that sometimes you change the water, and looking at it shortly after, you realize, they're regulars again. So you wonder, how come they would have hatched out so quickly?
Right.
But what happened is that you didn't realize, that the regulars would have clung to the roots of whatever plant you have inside there. Check the areas where your trays where you wash you drain your dishes and stuff like that. Talk to your neighbor. Get your neighbor involved, because I might not have any mosquito breeding on my premises, but my neighbor has. All right. If you have information, you get information from the health department, for example. You pass it on to your neighbor. Just share the information that you have, and as a community, you bond yourselves together and take ownership of your community, for example. Periodically, you can have cleanup campaigns, getting rid of all these white goods, the old stoves and the old washing machines, the old refrigerators that can hold in water, the tires and so on that can hold in water, and can breed mosquitoes. Clean up your community. So from your homes, go into the community, bond yourselves together, and keep your community clean. The bottom line is that if there are no breeding containers for the mosquito, there'll be no place for them to lay their eggs. If there's no place for them to lay their eggs, there'll be no eggs. If the eggs are not laid, there'll be no hatching out of eggs. And if there are no hatching of eggs, there'll be no adult mosquito. Right?
Thank you. The fruit of the week is guava. Guava is a rich source of vitamin C and a very rich source of fiber. Have some guava every day this week. If you're not interested in eating the fruit, you can make juice from it, or you can even make jams from it. Just consume some guava every day this week. And that has been this week's edition of Health Matters. I would like to thank Dr. Nisbett, the Medical Officer of Health in Nevis, and Mr. Anthony Webb, Port Health Officer, both of the Ministry of Health here in Nevis, for that very informative conversation about Zika virus and the Aedes aegypti mosquito. I hope that everybody adheres to the advice that they gave. Make sure that you clean around your home and whatever environment you may be in to ensure that there are no mosquito breeding areas, and to continue to educate yourself about Zika virus and how to prevent yourself from contracting the virus in the event that it does come to the Federation, or you may travel to an area that has the Zika virus. Thank you for viewing. I am your host, Webbe Nisbett, health educator at the Health Promotion Unit.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.